Ultra Fresh Pm Ointment is used to relieve dry, irritated eyes caused by various factors such as wind, sun, heating/air conditioning, computer use/reading, and certain medications. This product contains ingredients like carboxymethylcellulose, dextran, glycerin, hypromellose, polyethylene glycol 400, PEG 400, polysorbate, polyvinyl alcohol, povidone, or propylene glycol, among others. These ingredients help to keep the eye moist, protect it from injury and infection, and decrease symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. The recommended daily dosage and optimal timing for using Ultra Fresh Pm Ointment can vary, so it's best to consult with a healthcare professional for personalized advice. When using Ultra Fresh Pm Ointment, be sure to follow the directions on the product package. If you have any questions, consult your doctor or pharmacist. Do not use the ointment if it has changed color or appears cloudy. Some brands may have a milky appearance, which is normal as long as the color has not changed. For drops, they may be used as often as needed, while ointments are usually used 1 to 2 times daily as needed. If using an ointment once a day, it is best to use it at bedtime. To apply the ointment or drops, wash your hands first to avoid contamination. Be careful not to touch the dropper or top of the ointment tube. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. Look down and gently close your eye for 1 or 2 minutes. For an ointment, hold the tube directly over the eye and gently squeeze a small strip of ointment into the pouch. Close the eye and slowly roll your eye in all directions to spread the medication. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. If you wear contact lenses, remove them before using most kinds of eye lubricants. Ask your doctor or pharmacist when you may replace your contact lenses. If your condition lasts or gets worse after 3 days, be sure to inform your doctor. When using Ultra Fresh Pm Ointment, you may experience temporarily blurred vision or minor burning, stinging, or irritation. If these effects persist or worsen, it is important to consult your doctor or pharmacist. It is important to follow your doctor's instructions when using this medication as they have determined that the benefits outweigh the potential side effects. If you experience serious side effects such as eye pain, changes in vision, or continued redness/irritation, contact your doctor immediately. While serious allergic reactions are rare, seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Ultra Fresh Pm Ointment, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have any health concerns, it's important to consult with your doctor or pharmacist before using this ointment. It's important to note that after applying this ointment, your vision may become temporarily blurred. So, it's best to avoid activities like driving or using machinery until your vision clears up. When using Ultra Fresh Pm Ointment, it is important to be aware of potential drug interactions. These interactions can affect how your medications work and may even increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial to not start, stop, or change the dosage of any medicines without first obtaining approval from your doctor. This will help ensure the safety and effectiveness of your treatment. If this medicine is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, residents can call 1-800-222-1222 for their local poison control center, while in Canada, residents can call a provincial poison control center for assistance. Now, let's talk about the uses of Ultra Fresh Pm Ointment. This ointment is used to relieve minor aches and pains of muscles and joints. It can also be used to treat arthritis. The recommended dosage is to apply a thin layer of the ointment to the affected area no more than 3 to 4 times a day. It is best to apply the ointment at the same time every day for the best results. If you have any concerns about using this ointment, be sure to consult with your healthcare professional. When it comes to using Ultra Fresh Pm Ointment, it's typically used on an as-needed basis. This means you should apply it when you feel the need for relief from muscle or joint pain. It's important to follow the instructions on the label and consult with a healthcare professional for the best timing and dosage for your specific needs. Make sure to check the storage information printed on the package of Ultra Fresh Pm Ointment and keep it from freezing. If you're using preservative-free drops that come in single-use vials, make sure to discard them immediately after use or up to 12 hours after opening, as indicated on the product package. If you have any questions about storage, you can ask your pharmacist. Remember to keep all medications away from children and pets, and do not flush them down the toilet or pour them into a drain unless instructed to do so. When this product is expired or no longer needed, make sure to properly discard it and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.